Hey guys, my name is Juan Hernandez, and today I'm going to be talking to you guys about congenital chromosomal birth defects. These include Down syndrome, Patau syndrome, and Edwards syndrome. In normal circumstances, we inherit 23 chromosomes from each parent, making up 46 chromosomes for each baby cell. The three aforementioned syndromes occur when individuals inherit an extra chromosome from one of the parents. For instance, in the case of Down syndrome, it occurs when an individual inherits a full or partial copy of chromosome 21. The extra genetic material from chromosome 21 causes the characteristics typically associated with Down syndrome. These characteristics include low muscle tone, small stature, almond-shaped or upward slanting eyes, a single deep cut across the center of the palms, and a tongue that tends to stick out of the mouth. Keep in mind that these characteristics vary from person to person, depending on the severity of the condition. There are three types of Down syndrome: trisomy 21, translocation, and mosaic. The first is the most common, affecting about 95% of people with the condition. Each cell in the body contains 3 separate copies of chromosome 21 instead of the usual 2 copies. With translocation, it affects a total of about 3% of people, and is where a partial or whole extra chromosome is present, but in a different chromosome rather than being its own separate chromosome 21. With a mosaic, it affects about 2% of people and is characterized by the appearance of a mixture of cells with either 3 copies of chromosomes or 2. Down syndrome is the most common chromosomal condition diagnosed in the U.S., with 400,000 people living with it in the U.S. That means that 6,000 babies are born each year, or 1 in 700. The life expectancy is usually about 60 years. Similar to Down syndrome, Patau syndrome occurs when an individual inherits a full or partial copy of chromosome 13. Physical characteristics for Patau syndrome include heart defects, brain or spinal cord abnormalities, smaller poorly developed eyes, extra fingers or toes, an opening in the lip, which can include an opening in the roof of the mouth. Similar to Down syndrome, there are also 3 types of Patau syndrome: trisomy 13, translocation, and mosaic. The first is when there are 3 copies of chromosome 13 present instead of the usual 2. With translocation, it is when partial or whole chromosome 13 exists, but it is attached to a whole other chromosome. With mosaic, it is characterized by the appearance of a mixture of cells with 2 or 3 copies of chromosome 13. Patau syndrome appears to affect females slightly more than males. 50% of babies die within the first month, with only 5 to 10 living past the first year. Patau syndrome occurs in about 1 in 5,000 to 1 in 12,000 live births, depending on who you ask. The average life expectancy of a person with the condition is 2.5 days. Edwards syndrome occurs when an individual inherits a full or partial copy of chromosome 18. Affected individuals may have heart defects and abnormalities of other organs that develop before birth. Other features of Edwards syndrome include a small, abnormally shaped head, a small jaw and mouth, and clenched fists with overlapping fingers. Similar to the first 2, Edwards syndrome consists of trisomy 18, translocation, and mosaic. Edwards syndrome is the second most common chromosomal condition after Down syndrome, with a 50% death rate at birth. Baby girls tend to have a higher percentage rate of birth rates at 80%. Sadly, only 5 to 10% live past the first year, affecting 1 in 6,000 live-born infants, averaging a life expectancy of 5 to 15 days. Risk factors for all 3 syndromes include advancing maternal age. Also, after conceiving a first with one of the conditions, chances of producing a second baby also increases. It is important to keep in mind that neither trisomy nor mosaic strands are hereditary. Only translocation is.